Hi, I'm Dr. T. Nguyen, and I'm a podiatrist and owner of a direct care practice in Santa Cruz, California. I started my private practice with the insurance-based model because that was what everybody was doing and that was what was expected. It's all I knew to trade my services for a reimbursement check that would come months after the service was rendered. One day I received a sequence of 3 checks in individually stamped envelopes for all under 10 cents. Yes, they sent a check for less than the stamp that it came in, including the one that was only for 1 penny. At this point, I was already knee deep into debt, credit card debt with my private practice. I had taken out a business loan to make this work, and still I had student debt to pay. And I really didn't know what else to do. I even contemplated if I would stay in medicine. I was not prepared for the business side of medicine at all. And I bet many of you tuning in have a similar story where you know the system is broken and you're really over being undermined by administrators. You became a doctor to serve people, not to be a paper pusher. If you want to know what it's like to run your medical practice without relying on insurance reimbursements, I'll share with you some key points on how to know if your specialty will work in direct care. If you can imagine practicing medicine, seeing your ideal patients all the time, doing more of the services that you want to give and getting paid on time all the time without having to see the usual 30 to 50 patients a day, plus the administrative burdens of charting, coding compliance, and constantly being under the risk of audits, then I invite you to hear more at my live lecture. If you know the insurance-based model is not sustainable for you long-term, then this is the lecture for you. Watch my lecture and get all of your burning questions out of the way so that you can get on to building your dream medical practice without insurance hassle.